survivor. And of course, she'll be here to tell us her story. Good afternoon.
Good afternoon. Thank you for having me.
Just share with us briefly your experience with breast cancer.
Sure. So I was 37 years old when I was diagnosed with breast cancer. My kids were young, age 4 and 7, and this was something that was unexpected. It does not run in my family. No one that no one in my family has had it. So just one day I went for a checkup to my OB, and she just happened to feel a lump in my breast, and that's what started the wheel. So this is something that was an eye opener, because it's not something that anybody expects. It's not something that you're waiting for, or you never even think about that you could ever be a breast cancer, a victim, or you could even hear those words. But when you do hear those words, trust me, the whole earth just shatters, and you're just like, oh my gosh, like what is going to be next? And the only thing you think about are your kids and your family, and am I going to be there to see tomorrow?
Exactly, it's quite a fearful thing, and so how did you manage to just get yourself through that period?
Well, for me, apart from just having the cancer, a little bit was for me that I was already set on a spiritual journey, just a personal thing. So when I did hear those words, cancer, I was kind of on a path of my own, and I just had this very positive mindset. So for a few minutes, I did think, oh my God, like what is going to happen? But very quickly I said, okay, I will not let this tear me apart. I just had to change my mindset. And I think having that positive attitude gave me the strength to just get through it and know that, this is a temporary phase. I am not the first person to get breast cancer, and there are so many treatments out there. And I was actually blessed to be in America at the time, because after I got married, I moved there, and I had the best facilities available. So I knew in my heart that, I had to fight this. I had to get through. I did not have a choice, because I had to see my kids grow up.
Absolutely.
And I think having a positive mindset is 60% of the battle.
It's quite interesting, especially when you say having a positive mindset even after being diagnosed with cancer, which in most cases, even when we talk about other cancers, it's more of a death, a sentence for someone. How did the people around you, how did you break the news to the people around you, and how did they take it?
That's such a fascinating question, because for me, honestly, rather than myself, I was more worried about my family. I was worried about how my parents would react. I was worried about how my in-laws would react. And the first thing I told my husband was, don't feel sorry for me, don't baby me, this is my journey, I know I have to get through it. The biggest thing I need from you is to take care of the people around me, because I don't want them to shatter. And I think them seeing me and having that positive attitude gave them the strength that, oh, she's fine, she seems to be okay, all right, so you know what, she'll be fine. And just giving them that reassurance, and just letting them help you, being there for you is a big thing. And obviously at the end of the day, your family loves you. No one loves you more than your family. So they were there for me throughout the whole chemo, the whole thing. And it is emotionally and physically draining on you.
Absolutely.
And that the strength that the family gives you to help you with your children and to help you get through it is like no other.
Absolutely. And when you talk about issues of positivity, I think it just has to be both ways, because issues of cancer is shattering not just to the patient but also to the family around them. So it's something that it's like two weak people trying to give each other strength.
Yes, and that strength has to also be in the family, because if your family keeps putting you down and feeling sorry for you, it also breaks the patient. So that's something that I would like to reiterate. If there's anyone listening and going through it, don't make the patient or the person going through it, don't make them feel weak. Make them feel strong. Just help them where you can. Give them the strength that they need, because at that time, that's all they need is strength and hope. And and it will get through it, and they will get through it.
Absolutely.
All right, so we are live from ZNBC Kitwe Studios, and be part of the program. The number is on your screen. If you want to take part on the program, you can call us now, and we will definitely get your concerns, your additions, as well as your contributions to the program. This time around, we're looking at Breast Cancer Awareness Month, which is October, and we've got a survivor in the studio. Incredible story.
Very. And so this is the October, and it's actually the Cancer Awareness Month.
Yes.
What are your thoughts about this kind of awareness? Do you think it's Are we doing enough to actually sensitize the women?
So
Okay, and men, because men also
Yes.
do get breast cancer.
yes, actually,
Yes.
you'll be surprised, but
Men
there
do get
are
breast
yes,
cancer
there is a
too.
percentage of men
Yes.
that do get breast cancer.
Yes.
So when I moved back to Zambia 2 years ago, I was like, okay, what can I do? Because there was a lady who was a survivor who I met when I was going through it,
Mhm.
and she said, don't let your cancer go to waste. And I hold that statement to my heart very closely. So when I
Okay.
moved to Zambia, I was like, okay, what can I do here now to make my story countable, and how can I help others?
Mm.
So I searched and I found Zambia Cancer Society, which is based out of Lusaka,
Mm.
and I met this wonderful lady, Udi, who I believe you interviewed, and she's also a two-time survivor actually.
Mhm.
And I was like, wow, instead of starting the wheel, reinventing the wheel, let me join hands with her.
Yeah.
So now we did actually an event last year called Dukutober, and we are doing our second event tomorrow
Okay.
at Mufujani Riverview, and we're creating that awareness.
Mhm.
We are going to
Mhm.
have aerobics, which is and followed by Zumba. We'll have
Mhm.
some talks, and we'll also have some breast examinations. Actually, also cervical examinations free for everyone to come and
Awesome.
just be a part of this, and just take breast cancer very seriously, women. Do your self examinations, as you were talking earlier.
Yes.
Lying down and feeling
Mhm.
yourself. Take health in your own hands, because no one knows your body more than yourself.
Mm.
And be proactive. Talk to your doctor. If you feel a lump, don't just brush it away. Go out and talk, because these days the things we're exposed to, we don't know what could be what could be the cause of the cancer.
I'm interested in the
Dukutober.
Dukutober.
Yes.
Yeah.
The
So
top-
the
yeah.
duku
Duku.
that
Yes, the chiduku that women
yeah.
wear.
So
You
there's
know
actually
the
going to be a
duku,
lady
yes.
there
Uh-huh.
who's going to be who can put the duku on you, and
Okay.
it's so much fun. Even I got to wear that last
Oh,
year, and I was
yeah.
rocking it. I was like, wow, this is so cool.
A pink duku would be nice.
Yes.
That's what Dukutober is
Absolutely.
all about.
So,
Yes.
what would you say? What kind of a picture would you paint when it comes, to women actually being aware of their well-being in terms of health, especially that we're talking about, breast cancer. We've got survivors. UD is a double survivor.
Yes.
What really is it that you would love to tell, especially the women, in terms of, just making sure that they take care of themselves. They have these checkups.
Yeah. Well, first and foremost, you're never too young. I've met women at the age of 21 who have been diagnosed with breast cancer. So don't ever think you're too young. It's just a stigma that you're very young. I'm 21 or 22. It could just be anything. I don't have to get a checkup.
Yeah.
Even when I was diagnosed, I was 37. But like in America, at age 40 is when they say mammograms have to
Yes.
start. But I think now, as the world is progressing, things are a lot more apparent. The age is coming to be lower. So even if you're 21, you can be diagnosed with breast cancer. So just be aware of what you're putting in your body. Be aware of the signs that are there. Read up on it, because as women, I feel like we're exposed to a lot more than our male counterparts.
Exactly.
Yeah.
I'd like to take you back a little to your story. And you spoke about you being, positive about the whole situation. Now, we know it's easy to just say it, but the actual, getting to that point where you're so positive sometimes can be really hard. So just speak to some women out there, or maybe even a few men who are actually grappling with this illness. How can they actually push themselves to get positive and fight for their lives?
Well, for me, one thing that I kept telling myself was, yes, I am going through this disease right now, and yes, I am losing my hair, and yes, I have lost a body part. The hair will come back. Yes, I may not replace my actual body part, because I did lose my right breast and I got reconstruction surgery. But all this is temporary, and next year, this time, it'll all come back. And I was not going to willingly go out there and shave my head, so I had fun with it. I was like, oh, this is what I would look like. And just looking at life with a different perspective, and I know it's hard to say enjoy that moment. No, you won't be able to enjoy it, but just look at it from a different perspective, and see what life has to bring to you. And I honestly believe, and I've always lived with the mantra, everything happens for a reason. What is this teaching me? this time it's your time. Take that time to yourself,
Yeah.
and just look within rather than look, and get the help that is out there. Because I was that kind of a person who's always just going out, helping others, never letting anyone else help me. So
Yeah.
this was the moment where I learned how many people cared about me. I learned, wow, okay, you know what? Others can help me too.
Exactly.
And how much I am loved.
Mhm.
And it was an amazing time. So I grasped it, I took it, and I realized life is too short.
Okay, let's just pick up a caller, Priya, right now. You're through to Friday Express. Is it Patricia from Monze? We've lost Patricia. The line is on your screens. Please feel free to just call in and ask those necessary questions. Those of you who'd like some encouragement from Priya and her
Maybe
experience.
they want us to mention the phone line.
Okay, please go ahead.
22 30 19.
Right there on their screens.
It's right on the screen. So 22 30 19 is the number that you're calling us on. The area code is 0212 22 30 19. That's the number to get us on if you want to talk to us right here on Friday Express. And this time around, we're looking at breast cancer awareness, which was in this month of October. So interestingly, you've given us your situation, and before you actually took the taste, felt the lump in the breast, what else were you feeling?
Nothing.
Nothing.
It was a normal life. It was really
no other symptoms.
no symptom at all. So that's what I was saying. Like, you could just be sitting there having your cup of tea and boom. And it was honestly nothing at all. And I was just lucky that I just happened to have an appointment with my OB that day. And she was like, what is this? And I was like, I don't know. And she's like, oh no, we need to get this checked straight away. And that's what got the ball rolling. And they did a mammogram, they did an ultrasound, they did a biopsy to confirm that it is cancer. And I just didn't have one lump, I had 3 lumps. And so that way they had to remove my whole breast. In many cases, women opt to remove both breasts to reduce the risks.
Okay.
So I went on to remove my ovaries and uterus as well, because I'd already had kids, just to reduce the risk of recurrence.
Wow. And that's just like being a woman. I mean, our breasts mean so much as women, and
that's what defines
everything else.
us.
Yes, so going through such a procedure is not easy, but getting to that point where you accept your situation, I think is the greatest point that one can actually reach when you're actually faced with such a situation.
And having to look at yourself in the mirror every day and accepting the way you look is something that a woman needs to accept. And I'd also like to talk about the after.
Please go ahead.
Because when you're going through the chemo and you're going through everything, everyone's there for you. Your doctors are there for you. You're seeing your doctors every week. You're seeing the chemo nurses. You're in the moment. You've got to get through this.
Yes.
But when it all ends and you have that last meeting with your doctor and he's like, okay, I'll see you in 6 months. And you're like, wait, what? I'm not going to see you next week.
Yes.
And, everyone's like, okay, I'll see you later. And you're like, wait, what do you mean? Like,
Yes.
you're left alone. That is when the survivor feels, the patient feels like it hits you then. That's when you realize what you have actually been through. And that's when now you are trying to figure out how to live life again. Because what you knew of life before is not what life is anymore. Because you have to deal with all the side effects.
Yes.
It's been more than 5 years now since I've had my chemo and my treatments, and I'm still dealing with the side effects.
Really?
So anyone out there going through it, just give yourself the time, give yourself the patience, and people around, give your loved ones that time and give them that emotional support they need, because they are going through a lot. Their body is going through a lot, and it is not easy.
Would you advise some of the the patients who may have gone through this and now the after to also maybe seek some sort of therapy with regard?
Yes, if this is something you cannot cope with emotionally, definitely there's so much help out there. Definitely go for it, because there's no harm. There's no one judging you at the end of the day.
Okay. Let's see if we can talk to Christopher, who is on the line from within Kitu. Unfortunately, we've just lost Christopher.
Please keep trying. It would
Yes
be
or
nice.
no? Yes or no? Does it hurt?
What hurt?
When you have breast cancer, does it hurt? Do you feel the pain? Is that pain?
Not at the moment, but the surgery is the easy part. The painful part is definitely the first few chemo treatments and the surgeries. Yes.
Okay.
Yes.
All right. Wow, there you have it. Paxina has already said that breasts are important to women because it's what
they
defines
are.
them.
Yes.
Yes.
But we thank God, you
Yeah.
know. Yes, when you actually go through something like that and you have to let go of one or two of your breasts, it is well. I mean, that is the time that you face and begin to accept everything.
I should speak for you as well. I think we need both. We
Yeah.
need both. We need both.
Absolutely.
We're gonna take a break. Do join us on the other side.
Thank you,
We need
Priya.
both.